Good afternoon, and thank you for joining us. I'm Bridget Anderson, the President and CEO of the Greater Vancouver Board of Trade, and welcome to our series of business resiliency webinars on navigating COVID-19. Today, we are going to focus on mental health, a key concern for many of us as we navigate this unprecedented and challenging time. And in this time of uncertainty, we want to ensure our members and the broader business community can find answers to their most pressing questions. Through a series of free webinars, experts will provide guidance and answer questions to help companies navigate these challenging times. We encourage you to take part in this discussion. You can engage with us on Twitter, Facebook, and Instagram by using the hashtag GVBOT. We are also using Slido to allow you to submit questions. You can do this on your internet browser or on your phone by going to the website slido.com, and the password for today is GVBOT Health. Before we start, and especially in these challenging times, we want to thank our pillar partners, and they include TELUS, CN, YVR, BCIT, and Air Canada. Our long-standing partners are long-standing sponsors, and we're very grateful for their support, whose annual partnerships and commitments enable the important work of the Board of Trade. Also would like to thank our preferred media partner, Business in Vancouver. Today, we have the pleasure of having two speakers with us, Dr. Miki, Founder and Chief Science Officer from Starling Mines, and Mike Reid, Senior Manager of Health and Wellness at Pacific Blue Cross. Dr. Miki is a registered psychologist who specializes in neuropsychology and cognitive behavior therapy. He launched Starling Mines, which is an online educational program to help those increase their mental fitness. And Mike is a seasoned health and disability benefits professional with over 10 years of insurance and health and wellness product development, client and patient engagement support experience, and specific expertise in product strategy, innovation, and execution. Welcome to both of you. And Mike, I'm going to let you kick things off first to discuss the employee and employer impact of COVID-19. And then from there, you can pass it off to Dr. Miki. So first over to you, Mike.
Thanks a lot, Bridget. Sorry, I'm just trying to get my screen up here. This is the one thing that I'm really not that great at, is this tech stuff. So just bear with me. There we are. So thanks again, Bridget, and to the Board of Trade for having Dr. Miki and myself out, and thanks for everybody out there listening today for taking the time out to join us. To start us off today, I'm going to go through a bit of my background, review what we've been seeing from both employee and employer perspectives in today's climate, and summarize what our organization as well as other organizations have been doing to address the impact of COVID-19 on our respective businesses. So as Bridget had already mentioned, I lead the client relations and health and wellness areas at Pacific Blue Cross. My role is unique in that I get to interact with both employees and employers on a day-to-day basis. And over the course of the last 2 to 3 weeks, a number of areas of focus have come to the forefront, given what we're all living through right now. For employees in particular, the fear of the unknown, a new work environment if they're being redeployed, and an overall increase in stress and anxiety, which we could come to expect, especially this day and age. Specifically for employers, we're commonly asked, what are their responsibilities during this time of uncertainty? How do they address concerns over worker productivity if staff have been redeployed? What resources are available to employers to help support their employees through this pandemic? So we're going to address these 6 areas of focus over the next couple of slides before we move into the Q&A. So firstly, through the lens of the employee, obviously there's a natural fear of the unknown that exists among workforces today, given the level of uncertainty with high volumes of layoffs and fears about public health and safety. Dr. Miki is going to get into the clinical details around the anxiety that usually accompany adversity and the unknown, but for now, I'll provide some examples of how we've addressed this at Pacific Blue Cross in particular. So in times of crisis, not even just in times of crisis, but really in most cases, we believe that transparency is paramount. A regular flow of information from our leadership team to our staff has really been key. We've established FAQ pages for our employees and members that is updated regularly. PBC's intranet has links to webinars, job aids, and other resources to help support our staff. And our Senior Vice President of HR sends out daily briefs via email to ensure that all of our staff remain informed in an effort to ensure that nobody really feels left behind. We have found that, as many of our clients have, that the continuity of information delivery has had a positive effect on our employees. We also have a number of resources that we direct our employees towards, including virtual health platforms like EQ Care, Starling Minds, and MindWellU. So moving forward to the new working environment, or a change in working environment, specifically working from home, just a couple of things to remember when moving to a home office. Employees transition to a home office, or who are transitioning to a home office, should set up and keep a regular routine. Take health and nutrition breaks, if possible. Set up a dedicated workspace. I know I live in a 2-bedroom condo, so it's a little bit difficult here, but just try to make one corner of your home to be a dedicated workspace. So moving from there, if you have intranet capabilities as the employer, be sure to post tips from working from home so that your employees constantly have a resource. There's all sorts of information out there from experts that we can continually be pushing forward out to our employees. One concern that often comes up with working from home is the issue of burnout. Working from home means that your office is your home and your home is your office, and there's really no separation of worlds per se. So this can lead to working to longer hours than usual. It could lead to you sitting on your couch with your laptop. You can lose track of time quite easily. So to discuss this a little bit further, Dr. Miki is gonna go through how to manage work from home related burnout in just a few minutes. And finally, increased stress and anxiety. I mean, this is it's a general theme in the world regularly, let alone what we're living through right now. So, I'm sure that we can all agree that good mental health is part of good overall health. Given the world that we currently live in, a holistic approach living a holistic approach to managing your mental health is more important now than ever. So really just some quick, easy tips there. Just continue to eat healthy, practice good dietary habits, maintain social connections via virtual gatherings. I use the term physical distancing over social distancing because we want to maintain social networks and relationships so that we don't feel alienated. Try to get a good night's sleep and practice empathy, because we all know that this is not really business as usual, and we're all struggling in one way or another. So moving to the employer-specific lens here. So employer responsibility is really what the employers really need to know. So employers need to know that need to know their options and what supports are available to their employees and themselves. Employers can always access their benefits provider or consultant to seek out services to provide to support their organizations. Employers are also responsible for understanding the workplace responsibilities set forth by WorkSafe BC in concert with the BC CDC. These guidelines are readily available at worksafebc.com. We've been having a lot of discussions with some of our employer partners about worker productivity as well. Whenever we redeploy staff to new workplaces, facilities, or homes, there's always the underlying concern with employers with worker productivity. Really, to address this, it's important to set out clear expectations with your team so that all employees understand what's required of them. Schedule daily or regular virtual team meetings so that employees and staff remain connected, and prevent a team member really from feeling isolated. And then finally, employee resources. What's available? So specifically, what we've done at PBC is virtual health. It's currently addressing two concerns. People don't need to leave their homes to see a doctor for either assessments or treatments. And number two, these platforms are really helping relieve the pressure on our public health system. At Pacific Blue Cross, we utilize EQ Care for virtual medicine. And then about 18 months ago, PBC also partnered with Starling Minds to provide essential online CBT-based treatments for a lot of our disability claimants. Recently, Dr. Miki and his team have developed a COVID-19 specific platform designed to help the broader public manage the anxiety around COVID-19. This platform is free to everyone and is linked to the PBC COVID-19 FAQ page. Dr. Miki has kindly joined me today to walk everyone through his platform and discuss some of the clinical issues that COVID-19 presents to both employees and employers. So with that being said, I'm going to pass on the microphone to Dr. Andrew Miki.
Thanks, Mike. So let me switch over. Thank you to everybody. Thanks to Bridget and the Board of Trade for having me here. I'm really excited just to kind of try to explain to people what we try to do in response to COVID-19. One of the challenges that I think a lot of people have with their mental health is times of uncertainty and times of change and times of adversity. And I think that because of COVID-19 right now, I think for a lot of people, they're experiencing one or a combination of all three of those. And because of that, one of the things that we decided to do at Starling Minds is that we thought we had the resources available to put together a free online course just so that everybody has access to mental health, a mental health resource. And so if any of you are interested to do it either yourself or you can send your family members or your employees, it's at starlingminds.com. And when you land on the page, we have a pop-up and you can learn a little bit more about it. And then when you log in, we'll ask you for an email address and you'll set up a password. And then once you're in the program, it looks a little bit like this, where we've got an introduction. And really the point of the first session, what we're trying to do is we're trying to help kind of normalize what people are going through. Because I think that one of the biggest challenges is with a lot of the social isolation is that it's really difficult. Everybody's experiencing this in their own way. And everybody's experiencing various levels of stress and anxiety and worry with this. And so, we ask a few poll type questions. How much has it affected your life? And so people can say, they can respond to it. And then what ends up happening is that we've got this online community. So we launched this program on Wednesday, and we're really excited about the uptake that it's having and the responses that we're getting. So we've got almost 1,000 members from Australia to UK on it. And so the uptake is really starting to take off. But I think that the point around the first part of this program is that we're really trying to help people understand just to kind of reflect on what they're going through, but then also just to see what everybody else is going through. And so we've got a series of polls like that just to help people see how different people are struggling. And then in addition to that, we also have videos. So all of our videos are animations. They're about 2 to 3 minutes. They're short clips just to help explain basic concepts like anxiety and worry. And so, for example, one of the major issues that a lot of people are experiencing is more anxiety. And anxiety is a functional response that we're all supposed to have in response to danger or stress or the threat of danger. And so we often use the analogy that it's sort of like a smoke alarm. It's supposed to go off when there's smoke. But what ends up happening when our smoke alarm is constantly being triggered, it means that it's going to go off a lot more and their anxiety is going to be kind of triggered a lot more frequently. And when that happens, I think right now with COVID-19, it puts people in a place where they're experiencing a lot more anxiety and a lot more panic. And they have to know, what does it look like when anxiety gets excessive? What does it look like when your worry gets excessive? And one of the key things that we also try to do in the first session is to try to help people identify what are key sources of information that they want to consume. Because I think that one of the challenges that a lot of people have is that we're getting so much information from so many different media sources that it can be quite overwhelming, and it can also be quite anxiety provoking. So one of the things that we do is we direct people to a couple of key resources like the World Health Organization and the Public Health Agency of Canada. But we also try to walk people through in their workbook section here to really set a boundary around how much they're going to consume a lot of this information. So we want people to kind of develop a plan for themselves in terms of where are they going to get the information, how often, like how frequently are they going to consume that information, and should they have a time limit on it. And then what we also have in the program is an online community. And this is actually one of the most exciting parts of it where people are able to put in different comments. And in the first session, we asked people just, a little bit about what they've been experiencing as a result of COVID. And one of my favorite ones is actually from somebody in the UK who made a post about staying home. And the NHS has asked people to stay home. And this person goes on to talk about how there's 400,000 volunteers that have stepped forward to help with a crisis. And this person feels really conflicted because they feel like they should be doing more instead of focusing on their, quote, own selfish needs. This person's asthmatic, so there acknowledges that he could be in, or she or she could be in serious danger from the virus. So this person decided to stay home, but says that it makes this person feel like a coward, and they feel like they should get out there and help. And one of the really exciting things from our point of view is just how the community is really starting to rally around other people. And so this was posted late Wednesday. And then early yesterday morning, people were already starting to respond to this person, saying that this person's actually being wise to protect themselves right now. And another person said, I don't think you're a coward at all. Being asthmatic, you should be overly careful. And then the person actually came back and said, thank you for all your kind words and sensitive and sensible advice, right? So you can see that there's people who are starting to interact and help one another out. But one of the things that we also try to do is we try to help people understand what are different strategies, what are things that you can do during this time. And one of the concepts that we talk about is being in the zone. So when your anxiety goes up, your performance often goes down. And so if you're in a state of panic or much level anxiety and stress, you're not going to be able to think clearly and operate as well as you potentially could. So this session is all about trying to help people understand that. And we introduce different videos, different strategies for them to try. We've got 3 different ones here, diaphragmatic breathing, strategic breathing, and guided imagery, where people can try them and then rate their level of stress before and after and learn how to get into the zone more effectively. Once they've done that, if it's effective for them, we want them to set a goal to practice this, because one of the challenges that people are having is adjusting to being at home a lot more often and setting up new routines for themselves. So a big part of the program is goal setting and education around this. And then, again, we've got this community. And, one of the things that is also really helpful in the 3rd session is to really focus on how is it that people set effective goals. So a lot of people have heard of SMART goals, but sometimes we're not necessarily as strong at setting them ourselves. So we've got videos on SMART goals and how it works. We've got a lengthy list of different healthy habits that people can potentially work on. And then in people's workbook, we want them to list off all the healthy habits that they would like to work on. But then we then get them to set a SMART goal to specifically work on one of them so that they don't bite off more than they can chew. And then we go over some reasons for failure so that they can kind of improve their goal setting abilities. And then we also wanted them to set a series of other goals, activities that increase their level of pleasure. It's a really big part of what we do in CBT. So again, they list what they could do and set a SMART goal for increasing their level of pleasure over the course of the week. And then there's also things that people just have to get done. So for example, if somebody just got laid off, one of the things that they might need to get done next is that they might have to brush off their resume, or they might have to consult a financial planner. So these are things that people actually just have to get moving on and start and to do in order to move their lives forward. So we take them through a series of exercises like that. In session 4, we really try to help people understand a little bit more about their thoughts and how they think, and how because of the level of uncertainty, it's much more likely that they're going to worry about a lot of different things. And so we've listed some of the things that people that they generally worry about right now. And then we walk them through an exercise in terms of how is it that you can manage these thoughts? How is it that you can learn to balance these thoughts and come up with a better conclusion? So a lot of these are very common thoughts that people are experiencing right now during COVID. And so we try to help systematically, or we try to help people systematically go through each one so that they know how to balance it. And then in the 5th session, it's basically just a summary of a lot of key different concepts within the program that's been introduced. And we also talk about people's level of energy being sort of like a battery to prevent burnout. We talk about ways that they can recharge their battery, understand how their moods are changing, how they can kind of study it and track it for themselves so that they understand their triggers, and also revisit the emotional regulation exercises and the thought balancing. And so then by the end, people are commenting on what's been really helpful for them. And then what we've been planning after this is we'll have a series of other sessions that we'll put in specifically to talk about different challenges related to COVID. So that, like I said, it's available to everybody. If you would like to access it, it's free at starlingminds.com. So thank you. And I'll turn it back to Bridget for our Q&A section.
Thanks very much, Dr. Miki, and to Mike as well. A very comprehensive tool. And I want to get into some of the details first, but I want to roll it back a little bit. And Mike, I'll start off with my first question to you. So many employers, they have their employees working from home, and they are doing things like the virtual meetings, and they are making sure that they're keeping in touch, but recognizing that there's increased fear, increased stress and anxiety. What are some of those signs or those mental health issues that employers need to be aware of? What are those kind of early warning red flag signs?
Well, I mean, it's sort of difficult when people are redeployed to work from home too, because it's not like you're, as an employer, it's not like you're actually seeing your employees on a day-to-day basis. So those general red flags that you're looking for aren't exactly, they're not readily available to see on a day-to-day basis. So really, you're just trying to have a look at when you are having virtual meetings with staff, how are they reacting in those conversations? And then you can look at the broader workload or the broader production that they're actually coming up with, right? So are they still meeting deadlines? Is their production still remaining high, and so on? So really, those are sort of distant signs on trying to identify red flags from my experience, really. But really, it's just a matter of keeping regular contact with employees to just make sure that there's still no hallmarks or no changes or deviations in their typical everyday behavior. When you start to notice significant changes or even just small changes along those lines, then obviously there's going to be a little bit more concern with a possible mental illness starting to rear its head. I think that Dr. Miki would probably be able to speak to that too, a little bit more detail from a clinical perspective.
Yeah, I'm happy to speak to a little bit about that. Like I said at the very beginning, I think that, we often see patients come in, presenting with depression and anxiety primarily during periods of high levels of uncertainty, high levels of change and adversity. So because people are experiencing, all three of those right now, you're probably going to see an increase in people's, I guess, how they're presenting in terms of their mental health, and how they're probably starting to slide down that mental health continuum the longer that this goes on. And so you're probably going to see people experiencing soft signs of anxiety and depression, things like sleep problems, irritability, concentration problems, things like that. And then as that level of uncertainty ramps up, people have a tendency to worry about a lot of things, like a lot of what if things, like what if this keeps going? What if what if I get sick? What if my family members get sick? What if my aging parents get sick? And when that keeps happening, it takes a toll on everybody, right? And it slowly just decreases the level of energy and resilience that you've got. So it's a real challenge, I think, as Mike was saying, because as an employer, you don't have clear line of sight in terms of what your employees are doing all day, every day. So I think, I think earlier, Bridget, you were talking about just early, our people checking in a little bit more. I think that that's really important, and the importance of communication and supporting your people as empathetically as possible.
And Andrew, I just want to pick up on something that you were saying a few minutes ago when we're talking about the volume of information that is happening right now. I mean, the news cycle has been 24/7 for quite some time, but there is an increased cadence of information and updates that are coming all the time. And so can you give people some guidelines on how to manage that and what they need to be doing, still keeping up to date, but also making sure that they're taking a break from it as well?
Yeah, I think that's, it's been so important for people to understand for themselves how much information they need and where they need to get it from. I think that if people don't do that, and if they don't set an assertive boundary for themselves in terms of what that looks like, I think that the way that a lot of the both social media and more traditional media has been put together, it's designed to get people's eyeballs on it, right? It's designed to get people to read to read the articles, to buy the newspapers, to watch the news, and there's a lot of pros and cons to this. But I think that one of the challenges is that sometimes it almost can feel addictive for people, that they feel like they have to know. And one of the challenges that people have when it comes to anxiety is that sometimes what people do to try to get to feel a little bit better, because there's so much uncertainty in the world, right? And even the news they don't have all the answers, right? And so because of all the uncertainty, sometimes people chase after that. And so then they try to consume more and more and more in an effort to try to contain or manage that level of worry and anxiety that they've got. But then it ends up being something that just keeps building. And then ultimately people end up experiencing anxiety issues, right? So I think that it is very important for people to have a very clear boundary around what they consume and how much and how frequently.
Thanks for that. Before we go to Slido, I do want to ask you a question, Mike, because we talked about burnout and knowing so many people are working from home, and it's really difficult to have a separation between home and office now. But when we think about the hours that people are working, many people are trying to also juggle family responsibilities. They have kids at home. So what is an employer's responsibility to ensure that they are giving good guidance to employees so that there are some boundaries around that situation?
Yeah, well, as I sort of mentioned in some of my remarks earlier, I think it's really, before you redeploy any staff to a home office or any other remote office location, it's really imperative for the employer to sit down with the employee or employees as a team to really lay out what the framework of the expectations are. So whether that's ensuring that somebody signs in and signs out at specific times of the day, whether or not they have daily check-ins or every other day check-ins on a regular cadence sort of thing, right? So it comes down to that initial conversation when we're setting this up, really, so that we can establish a strategy between the home office and home base, really, per se, right? So what are those clear expectations, not just from the employer, but the employee as well? It's a two-way street. So what does the employee expect from the employer? They need to outline that their environment, the employee needs to outline that their environment is also changing, and they do have family at home. I have a little dog at home, those types of things, right? So they have effects on the way that you're able to conduct your work on a day-to-day basis. So all of those things really, really need to be discussed clearly and in detail so that you can really avoid overworking yourself. Because, for example, you get your kids come in and interrupt meetings, or they come in and while you're working, as we've all seen over I'm sure the course of the last couple of weeks, but you want to make up that time. But if we continually do that, you're going to find yourself looking out the window and there's not going to be the sun up and your clock's going to tell you, say it's 10:30 p.m., right? It's just not sustainable. So really just to establish those clear guidelines at the outset from the employer and the employee's perspective, and having mutual agreement on what those expectations are.
Thanks for that, Mike. So as an employer, you do want to make sure that you're checking in on your employees' health, especially during the time of crisis. But how can you do that in a way that is sensitive and respectful, and recognizing that it's the employer-employee relationship? Miki, Andrew, if you could give us some guidance on that would be super helpful.
Yeah, well, I think that every business has its relationship, from management to the employees, and so I think a lot of it has to be based on, I guess that relationship, hopefully leveraging a positive relationship, right? I mean, I think that similar to what Mike was saying, I think that because of the amount of change and how quickly people have had to adapt to this, because it was only about 2 weeks ago when this really started, like this initial wave really started to hit and people started to work from home. And so it's a relatively short period of time that both employers and employees have had to kind of adjust to all of this. And then as a result, there's so much change going on in people's homes where, a lot of times you can have, two working parents and young kids, and it's a big adjustment period. And so I know that Starling, like, we've really tried to adjust, hours, meeting times are really flexible because we know that there's a lot of childcare issues that a lot of people are having, especially with really young children. And then with schools being out, you know, it's a really big issue. And so one of the things that we've done is that we have, you know, we've got daily huddles, you know, daily meetings, just to kind of check in with people. We've got a lot of virtual meetings now, just even this afternoon, we've got one just as a, well, because we launched the program, it's just kind of like any excuse that we have to bring everybody together, just to kind of celebrate anything and just check in with everybody and just see how they're doing. All of our managers know that, you know, they've got to be in constant communication with their people, and just support them the best that they can. We just feel like, you know, the stronger that we all are throughout the organization, the more we communicate to try to reduce the uncertainty, but even sometimes just being candid, in terms of, like, because we don't have all the answers either. But I think if we, you know, try to, you know, filter that to, you know, to all of our employees as well, in terms of what we can't, you know, what we do know and how we do think we're going to move forward, so that they are kept, you know, so that we're walking right alongside them, I think is really important.
And anecdotally, I'm hearing from lots of our members that they're finding video conferencing to be a more helpful tool than the just an audio conference line, so that they have a chance to see one another, to check in, and that's a little bit better than just hearing somebody's voice, to be able to see them face to face. I'm going to go to the top of the question or line here, about those people who have already been laid off or are about to laid off, and how can we help support them as employers as they're easing into an even more difficult time than they might be feeling already. And I don't know who wants to tackle that. Do you want to try that first, Andrew?
Sure. Well, I mean, I think that's similar to what Mike was saying. I think that this is a real time for empathy, right? I think that if that is the case, and you unfortunately have to lay off somebody, or you're on the verge of it, I think that trying to approach it with as much sensitivity and empathy as possible, right? Because I mean, everybody's in this together to a certain extent, and the amount of stress that everybody's experiencing has gone up. And so, as the employer, you know, I'm sure you're going through a lot of stress and issues yourself, just in terms of trying to navigate the business, keep it sustainable, and keep it moving forward. And so there's a lot of things that are going on from your perspective. And then from the employee's perspective, you know, just the level of stress around, are they even going to have a job, right? Are they going to have a paycheck, and how long is this going to go on for, is a very intimidating prospect for the vast majority of people. And so if that is the case, then unfortunately, sometimes that's the way that it has to go, you know, because business decisions have to be made. I think that doing it with as much empathy and doing it as quickly as possible, with as much help as possible. I mean, I know that there's government support, and that there's more and more information coming out all the time. So I think, you know, trying to be up to date on that, and trying to help bridge the employee as much as possible. But then also just being as straight and direct with the person as possible as well, in terms of what has to happen, so that they can actually get themselves mobilized to figure out what they're going to do. Because there's going to be that initial shock, and that's just unfortunate, right? I think a lot of people have experienced that, where it takes a little bit of time just to kind of take it, recover, and then you got to start moving forward, right? And so to try to help that person get through that period, that transition, as quickly as possible, so that they do start moving forward in whatever way they can, if it is what will ultimately help them with both their career and also their mental health.
And Mike, from a benefits provider then, are there resources available to help people who are facing layoff or have just been laid off?
Well, there's a number of resources out in the public sphere, to be honest with you. I mean, not necessarily just from the benefits provider, but I know that my colleague actually just this morning sent me a link to the Mental Health Commission of Canada. They've now got another free application out there for folks that are starting to experience just these types of issues with being laid off, or the potential of losing your job, and so on and so forth. So we would try to support any of our clients from a benefits provider perspective with any one of those types of resources. So acting as an organization that has access to these types of links and supports and so on. So we would look into what your EFAP program has access to, whether it's mental health supports, or even many EFAP providers provide financial, fiscal support, relationship counseling, even, because obviously losing your job, and even if you're just working from home and it's the two of you, you know, you might need some marriage counseling in that particular situation as well. But yeah, from a benefits provider perspective, there are a number of resources out there, whether they're from the the provincial, federal, or even municipal governments, to EFAP programs, to virtual healthcare. There's a number of different ways that we can go and support organizations that are looking at job loss.
And Bridget, one thing that I could add as well is that, one of the things that we've seen in our community already is that some people have mentioned how they have lost their job, or they feel like they're on the verge. And we've had a lot of feedback just in terms of how helpful it's been for people even just to write that out and to post it. And I think what we've seen in our community as well is just a ton of people talking about how helpful it is to see other people posting that, because it just kind of normalizes it that they're not the only ones that are going through it. And then we had somebody else come in last night that I noticed, who posted that he's been in a state of panic all day because of being let go, and used the regulation exercises for about 20. They're only about 2 minutes, but he used it for 25 minutes and was able to get himself down to a calmer state so that he could kind of think a little bit more clearly. So one of the things that that's one of the reasons why we try to make this free for everybody, so that if you do have to lay anybody off, this is a tool for people to manage their mental health, whether they're working or not.
And Andrew, maybe you could just repeat what the URL or what the website is that people can go to use that tool.
Yeah, thanks, Bridget. It's starlingminds.com. It's Starling like the bird, minds like the brain, and .com.
That's great. I'm going to jump down to the bottom of a question here, because I think for a lot of employees, they are feeling stressed out and they're unsure about how they should communicate to their managers or their supervisors about that. And the question is, if they're feeling stressed out and down, should they be communicating that? Is there a fear that if they do that, that their manager might look at them differently, and perhaps that could be that would not be a benefit to them?
Yeah. So, I mean, the short answer is yes. Be upfront and talk to your team, whether it's your manager or supervisor and so on. I think that sort of the underlying theme to a lot of what we've been discussing today is that high level of communication between whether it's all the way up to your C-suite and down to your staff. Really having good ability to have discussions between management and staff is really, really important. I hear this this whole "I'm afraid to lose my job if I speak up" narrative quite often, and I haven't seen it myself in my particular organization, but honestly, as a people leader myself, I would want my folks to come to me with whatever concerns they have as soon as possible, so that we can work together to address those things. As management, as an organization, the last thing that we want to do is actually lay somebody off or move on from somebody. We want to support our employees as best as we possibly can. So I think that the foundation of that is really having good open lines of communication and being able to get into the details of what is working, what's not working, and what supports are available for all of those people. And we can't really delve into those unless one of those two parties engages the other.
Yeah, I agree with that a lot, Mike. The only exception that I would say is that I think it's really up to the individual to kind of assess their own situation and use their own kind of almost like their own interpersonal intelligence. Because if you have a manager that isn't the most supportive, then it probably isn't the best thing to say to them. Right. And so I think that, it's true. In the most ideal situation, it's one where, you're both on the same page and the manager is very supportive. But, as we know, that's not always the case. Right. So I think that people have to be, clear in terms of what it is that they are going through to a certain extent. But they should also, just use their own sense as to how much to disclose.
Mm-hmm.
Great. Mike, I'm going to go back to you because we did talk about this, but there's a specific question on it and more people are voting on it. So just around requirements for employers, what they're obliged to do around their employers' mental health. Maybe you could repeat some of that and just maybe more clearly state what some of those obligations are. Yeah,
so there's quite a list, and I haven't committed to memory just yet, but employers are, in the unionized environment, we generally call it a fiduciary responsibility for the health and well-being of all of our employees. So employers are mandated to adhere to the regulations as set forth by WorkSafe BC. And in this case, around the COVID-19 pandemic, it would also be in concert with what the BC CDC sets out, would be a safe workplace, right, or a healthy workplace where somebody wouldn't necessarily be exposed to the virus itself. So the requirements that employers, both union and non-union, that they are obliged to follow, quote unquote, are listed at WorkSafe BC. They're actually they're not quite on the homepage, but there's a link to it right away. It's quite visible. So if anybody out there does want to go through all of those listings, it's at worksafebc.com. It's quite a long document.
That's fantastic. I want to talk a little bit about the second question here about online free resources, and maybe Andrew, you could speak to that. You've got yours, obviously, Starling Minds, and that's a great one. But are there some other ones that I'm thinking of? You know, I use the app, one of the meditation apps. I think the one I have used from time to time is Calm. But there are some free apps out there and some other free resources. Any that come to mind that are really good?
Yeah, I think that, you know, Calm and Headspace, I think that they're both very similar in the sense that they offer, you know, what we call like emotional regulation strategies or exercises. I think that they can be quite effective for people who are in a state of, you know, stress or panic, and they just want to bring that, that level of arousal down, kind of to get more in the zone, right? So I think that things like that could be helpful. I think there's an education one. Used to be Anxiety BC. I think it's now anxietycanada.com. I think that that's a really good resource just for people to have an overview in terms of the different types of anxieties that are out there. But, you know, to be honest, the online space is much like the face-to-face space, in-person space, where, you know, I think over the last few years, the market is starting to get flooded by lots of different types of programs of varying levels of effectiveness and quality. So, you know, just like the media, just like, you know, Starling, I think it's up to every individual to really kind of go in, investigate for themselves, vet for themselves, and be an informed consumer as to whether or not they think that it's the right fit for them.
Great, thank you. And we've got time maybe for one last question. And because it would be nice to end on a positive note, I'd like to get your thoughts about the importance of happy activities, because you did mention that, Andrew. And I see a lot of people who are working from home, staying home, and they're doing things like gardening or baking, music. Talk to us a little bit about why that's important. And then Mike, I would like to get your thoughts as well.
Yeah, I think that, you know, in my practice, I've often taken like a real pattern type approach, right? So I think that when people are working and when they're leading their regular lives, you know, there's a pattern of a lot of things that are going on. Now, I think that with what COVID has done, it's disrupted a lot of patterns in people's lives, right, or routines. And so what ends up happening is that because people are in a heightened state of anxiety and stress a lot more often, even if you're just to kind of time it over the course of the day, it's gone up a lot more. And so to your point, Bridget, like it's really up to people to really be a little bit more intentional in terms of scheduling things, deliberately doing things, whether it's going in the garden or, you know, reading or whatever people do for pleasure. I think that intentionality is really important. One, because if you think about your brain and how how it lights up, or how the activity is when people are stressed, right? And when it's like that over and over again, you're kind of rehearsing that. Right, and if it's really anxious, it's the same thing. Those connections in your brain are rehearsing it. It's getting stronger and stronger. And so one way to offset that is to have, you know, more frequent moments throughout the day where it's kind of lighting up in a different way, lighting up in more of a pleasurable way to offset that. And so then that's why it's important to do it and to build up new habits, because as everybody's kind of figuring out their new normal from here on out, right? So we don't know how long this is going to go on for. It's really important for people to start as early as possible and then to get going. And it's going to be like dieting or exercise where you get on it and you're great for a while and then something happens and you fall off, right? But it just, you know, it's that constant effort to kind of move towards that. I think it's the most important.
And Mike, maybe you could give some perspective when we're thinking about the employer's point of view, maybe how to build some of that in, maybe through team building or something virtually. What are your thoughts there?
Yeah, so I mean, just really jumping on what Andrew just said there, I think it's really important not to forget who we were before all of this. And the longer this goes on, obviously, the more difficult it is to really remember, you know, what fun was like before all of this. And really, from the employer's perspective, you know, there are things that we can do, and it's really not necessarily sanctioned events per se or stuff that is actually sponsored by the employer, but there's a lot of A lot of things, for example, a number of my colleagues have got a virtual happy hour thing set up this afternoon, and it's the entire group sales department is all getting together, right? Because again, we all have really great relationships in the workplace, and I think it's almost lost on a lot of people that, you know, those are some relationships right now that are a little bit strained because we don't see each other anymore, right? So that's another loss here. So, and we want to try to make sure that we keep that happiness continually established as well. So if we can continue to manage our fun relationships from the workplace, whether it's virtually or otherwise, I think that it's a great step in the right direction, and it'll definitely bridge us to the point where we can get back to actually seeing our friends and colleagues, and hopefully in the near future.
Great advice. Thank you both, to you, Mike, and to Dr. Miki. Really appreciate you taking some time today to talk about this really important topic. And you can watch this webinar again. You can go to boardoftrade.com and it will be updated within a matter of hours. And we want to continue this important conversation and stay connected. So we are hosting a series of free webinars on navigating COVID-19. Over the next several days, we'll be bringing together experts to speak on crisis to recovery and accessing government funding. And we have also created a business resource page designed to provide planning toolkits and information to businesses and individuals in our region at boardoftrade.com. And this page will be updated as new information becomes available, and we will continue to find and create resources to support you as the situation evolves. Thank you to everyone for being part of our webinar today. We look forward to connecting again soon, and I will leave you with the wise words of Dr. Bonnie Henry, our Provincial Medical Health Officer. Be kind, be calm, and be safe.